Welcome to this presentation, Clinical Supervision, Integrating Philosophy Models and Personal Style. This presentation will help you see how clinical supervision is an art form grounded in scientific methods. My name is TJ Finn. I am a licensed professional counselor in Texas with a certification in neuropsychotherapy and a master's in human development and counseling. I'm also a PhD student at Grand Canyon University. The primary purpose of clinical supervision is to protect client welfare while supporting supervisee development. Supervision serves a dual function. It is both formative and evaluative. Supervisors guide counselors in training in developing clinical competence, ethical judgment, and professional identity while also monitoring performance and readiness for practice. Effective supervision balances accountability with support, ensuring that supervisees grow in skill while clients receive safe, competent care. Clinical supervision is grounded in philosophical assumptions about learning, growth, and human development. Constructivist and humanistic philosophies emphasize meaning making, reflection, and relational safety, while scientific foundations ensure accountability and evidence based practice. Effective supervision integrates both honoring the art of relationship building and the science of clinical competence. This integration allows supervisors to respond flexibly while remaining ethically and professionally grounded. Culturally relevant supervision requires supervisors to engage in continuous self reflection and cultural humility. Supervisors must attend to power dynamics, cultural identities, and systemic factors influencing both supervisees and clients. Skills such as open dialogue, curiosity, and validation foster a supervisory alliance that supports learning across difference. When supervisors model cultural responsiveness, supervisees are more likely to integrate these practices into clinical work with diverse populations. To ensure culturally sustaining supervision, supervisors must intentionally integrate culture into all aspects of supervision rather than treating it as an add on. Strategies include routinely broaching culture, inviting discussions of identity and bias, and encouraging supervisees to contextualize client concerns within cultural and systemic frameworks. Adapting supervision style to supervising needs supports equity and enhances ethical practice. My personal supervision style is most influenced by the integrated developmental model and the discrimination model. IDM provides a developmental framework that supports supervisees across stages of growth, while the discrimination model offers flexibility in supervisory roles and focus areas. Together, these models allow me to tailor supervision based on developmental level, clinical skill, and contextual demands while remaining grounded in theory and research. Applying supervision models in practice requires flexibility and intentionality. Developmentally matched supervision ensures that supervisees receive appropriate levels of support and challenge. Shifting supervisory roles based on supervising needs allows for both skill development and autonomy. Structured feedback and reflection support deeper learning and strengthen professional identity, particularly in complex clinical environments. Technology has significantly expanded the reach and flexibility of clinical supervision. Telesupervision increases access for supervisees in rural or underserved areas, while recorded session reviews enhances feedback and self-reflection. Digital documentation supports accountability and continuity of supervision. When used intentionally, technology can strengthen learning and supervision outcomes. Despite its benefits, Technology also presents ethical challenges. Confidentiality risk, reduced nonverbal cues, and blurred boundaries can impact supervision quality. Supervisors must establish clear expectations, use secure platforms, and intentionally foster relational presence in virtual settings. Balancing efficiency with human connections is essential to ethical, effective supervision. Supervisors hold significant legal and ethical responsibility for supervisees' actions. Ethical supervision requires clear, informed consent, thorough documentation, and awareness of supervisor liability. Supervisors must address dual relationships, competence concerns, and mandated reporting obligation. Ethical codes provide guidance, but supervisors must apply judgment within real world contexts to protect clients and supervisees alike. Gatekeeping is one of the most challenging yet essential aspects of clinical supervision. Supervisors are ethically obligated to evaluate competence and intervene when supervisees are unable or unwilling to meet professional standards. Remediation should be supportive and structured, but supervisors must be prepared to limit or terminate training when client welfare is at risk. Gatekeeping upholds the integrity of the profession. My supervision style integrates developmental theory, cultural responsiveness, and ethical accountability within a supportive relational framework. I strive to balance encouragement with evaluation, fostering supervisory growth while prioritizing client safety. Grounded in research and guided by ethical principles, my approach allows flexibility while maintaining professional standards. This integrative style reflects both the art and science of supervision. Clinical supervision is both an art and a science. Philosophical foundations shape how supervisors engage relationally, while supervision models and research guide ethical and effective practice. Developing a personal supervision style is an evolving process informed by theory, reflection, and experience. When supervision is intentional and grounded, it supports supervisory growth, client welfare, and the integrity of the counseling profession.